Everybody, my name is Josh. I am the innovation manager and I work in the philanthropy department. That's our grants and fundraising teams. And when I'm in the office, I'm at Summer Street.
And hi, everybody. My name is Gabby Florio. I use the she series pronouns. I am a programs coordinator under Dana directly, so I oversee all of the programs in any administrative capacities. I'm also a member of the COVID-19 response team.
So thank you for joining us. We're really excited to talk about innovation and centralized intake. Before we launch into our fun and exciting presentation, I just want to let everybody know about two quick upcoming opportunities that we're going to have. One is a book club. We've had a few times in the past. There have been webinars or short things that folks have sent out. The different smaller groups. We did this in the Volunteer Army once or twice that folks could read, and then we had chances to chat a little bit. Really excited to have some opportunities to do this more and around topics related to innovation, how we do our work, how we support families. So keep your eye out for emails that say, here's an article or here's something to watch, and some opportunities to get together to chat a little bit about it. And also, we're going to have a hackathon coming up soon. That'll be an opportunity to really think about how we work together to solve a problem related to working with families. So keep your eyes out for both of those things. So now back to centralized intake. So you've heard before, just want to share the vision for centralized intake, but here it is. Fully functional, multidisciplinary, multilingual, and culturally competent centralized intake team that's embedded in each program and serves as a seamless connection between the programs, and will ensure the clients are efficiently enrolled in programs, they have an easy way getting in, and the programs really meet their needs. And our goal is to have this all up and running. We will have this all up and running by December 31st of 2023, which is coming up. Before we start talking about everything else, I just wanted to thank everybody that came before this and the great work that they did. The Volunteer Army team that got us to this point, and the team that's been working on it now. That's Justice DeRosa, Brianne DeFaria, Carmen Gonzalez, Carolyn Calhoun, Dana, Natalie, and everyone else who's popped into meetings to share their feedback, to tell us a little bit, to talk a little bit about work. Before we launch into really talking about what's going on in centralized intake, I want to just sort of make sure we're all on the same page. So we're going to talk about two things: what's happening in centralized intake and how it's innovative. And really by innovative, we're thinking about two things. So first, the first thing in innovation is really this opportunity to think about what we learn when we make mistakes or when we're successful, and make sure we're using that to build and do better. And the second is about really being intentional about how we design things and being human-centered. So thinking about families and staff when we do it. So with that in mind, we already do intake. We have a system for doing intakes at our agency. I want to ask you guys some questions about it. So here we go. Who do you call? Do you know what a family needs to do? And do you know what will make a family eligible if
a family wants to enroll in Early Head Start, Healthy Families America, or Nurse Family Partnership? Who do you call?
How about someone you know is interested in providing foster care, and what are you going to do? What do they need to know?
If a parent you're working with is newly pregnant and needs access to nutrition support, do you know what they need to do? Who they need to call?
What if you think the kid you're working with and you think maybe they have a speech delay? How do you get them into early intervention? How do you get them connected to that service?
And a family wants to enroll in Head Start, but that's a pretty paperwork heavy program. So do you know everything that you need to make a family eligible for that?
I know when I did this work, there were some things I knew for sure. There were some things I didn't. And usually I would end up calling a manager and then being told to call somebody else, and then, getting a phone number that I would give to the family, and then hoping the family called. And then when they didn't call, maybe I'd call, and then hope that the family got in touch with the person and hope that they got stuff scheduled. And really, I remember feeling clueless myself and feeling like, families felt only about as clued in as I could make them, which was often sort of clueless about this work.
So our current system that we have really right now, it works to a point. We have 16 programs that oftentimes function like their own mini little agencies. What is really good is that for all of our programs, we have different ways that a client can become enrolled with us. They can put in an inquiry on our website. They can call somebody if they have contact information. They can email somebody and hope that they're emailing the right person. But that process is really confusing too. And if clients need to be enrolled in multiple programs, it's really hard to tell their story multiple times, talk to different people in different programs who are collecting the same information on a family in a variety of different databases in a variety of different ways. It really leaves everyone sort of feeling like this, yelling at the phone, frustrated, not really sure who to call, how many times they'll have to talk to different people with the same information. Centralized intake really hopes that this feeling of rock climbing really stops for families. What families really see is the thought of, I need help. And like rock climbing, there's a lot of places that you could grab, but you're not really sure where to grab first to get to the top of the rock. So we're going to use this a lot, but it sort of feels like this for families. You're grabbing in a bunch of different directions, not really sure what you need. If you're pregnant, it might be home visiting, but you're not sure which program. If you need preschool, it could be Head Start, it could be pre-K. These requirements are a lot. It's a really overwhelming system for our families as we have right now. So with centralized intake, what we're hoping to do is sort of build a ladder with families instead of rock climbing. So with a ladder, there's a really strong bottom rung that you can use to climb on top. And we'll be using this analogy throughout the presentation, so get used to a ladder with us. So as an example, if a family calls Children's Friend to request Head Start for their 4-year-old, and then we find out that there are a slew of other things that they might need, they can build on the services they need with Children's Friend in order to sufficiently provide successful outcomes for their family. So the ultimate goal will always be to have a family that has great outcomes. But with this example, what we're really focusing on are these bottom rungs of the ladder, and this is where centralized intake comes in. We want to talk with the family to decide what they need and to grow with them as well. What we're really hoping is that centralized intake will sort of give us this relationship where clients will be quickly connected to the appropriate services for them, and clients will find it easy to know who to call regarding services, that they'll have more trusted contacts throughout Children's Friend as they build a relationship with centralized intake and programs, and they'll feel supported throughout their process as they sort of navigate our different programs and the different things they might need. For our staff, we're hoping that meaningful relationships with families who are engaged develop more quickly and more rapidly, as they'll be able to be connected to their programs more quickly and more efficiently. And staff will have a lot of clarity about where and how to refer and what services we have in-house. Sometimes as a worker in one program, you might not know about the variety of our different programs. And we have a lot to offer families here. So we're really hoping to also improve collaboration within programs and across different departments.
So we're aiming for all that, the process of really supporting families, but we really want to think about how we do this and how we got to here, because I think it's helpful, and that's really helpful from an innovation standpoint to reflect on what we've done, and like I said, sort of the failures, the successes. So let's talk about some of those failures and some of those successes. We did this before, way back. We launched Tier, and we said Tier is going to save us. It's going to make everything better for everyone. Everyone will have access to everything. It'll just be perfect and beautiful and lovely. Tier did not save us. And really, we learned from that. We learned that just having the information in a database and having some information accessible doesn't necessarily help us serve clients better in its alone. So we said again, like, we need a process for using Tier to help us make connections. And this was another attempt at centralized intake. Spend some time thinking about, what does that process look like? How do we use Tier to work for us? We spent a while talking about it and spending time talking about forms and what question we should ask so that we know, I think we talked about 10 questions or 20 questions that will tell us exactly what we need to know, everything about a family, so we can put them in the perfect program. But we realized from that we didn't do a lot then. And we realized what we really need to think about is not just what we're doing in Tier with the data, but what we're doing with the people, how we're supporting the families and how we're working with people to help them get connected to programs. So the next time we went the other direction, we just said, what if we just throw a ton of time at supporting a few really, really clients with that needed a lot of support. This is the Capita project that I'm sure a lot of folks have heard about, that we talked about earlier in the vision conversation. We spent a lot of time and a lot of energy supporting a handful of clients. And this worked to some degree, but it's really hard. It's a lot of work. It's a lot of looking in databases and a lot of talking to clients and spending time with clients and really working closely with them to make the work before they're even in a program. And that's really difficult. And because sometimes families don't get the supports they need as quickly as they need them because we're spending time talking with them about other things. And sometimes we end up taking on so much burden. So we really need to think about how we balance it and do everything we need to do while also supporting families. And that's why we sent this to the volunteer army, and said, what if we asked a team of staff, including those that actually do the work for all the different programs, to really look at the process and come up with something that felt like it would really work for the agency. So they did, and they built something and pushed us towards a process that we think is family-centered, seamless, is outcome-driven. It helps us advocate for families, and it helps us, be resourceful with the money and the time that we have. So this is the process. It's basically the same ladder that Gabby showed you a little earlier, but for everybody. We get a referral. We talk with the family about their priorities and concerns. Centralized Intake decides with the family, not for, but with the family, what they need and what they're eligible for. And then Centralized Intake helps to make a connection to the program or programs that make sense. And it works with the family to have a plan for what that's going to look like, and then connects the program to the plan and the program to the family. So the program knows what's going on, the family knows what's going on, and both the program and family can get started talking about the stuff that matters to the family and to the program, not about like the family's address and their phone number and their social security number and their insurance information. And we really think that opportunity to just dive into working and doing the work that we all want to do with families will lead us to having better outcomes for families and kids and parents. But we don't know exactly how we're going to get there. So we want to talk a little bit about the challenges that we're already experiencing and how we're getting to solve them.
Well, our first challenge is really addressing these two questions, which is this process family-centered and is this seamless work? So with these sort of guiding questions on the right, what do we need to know to help families out? How do we get the right information for different programs? How do we gather and share the information so that families don't have to repeat themselves and tell their story over and over again? We're really looking at the moment of intake as this crucial opportunity for gathering information for our agency to really help and support families. Families often go right into one program only to learn that another program that we have in-house is actually a better fit for them. So Centralized Intake is really looking at what can we learn from families to help us get to the right program quickly, which sits at the second and third rung of this ladder here that we showed you before, the second and third part of our process.
And so to bring in like a little bit of innovation stuff. So we talked about failure. The work we're doing and the way we're approaching this is really through a human-centered design perspective. So when we say how do we get information and how do we figure out the right information and how do we connect families? We're not just sitting and saying, how do we do this? And then writing it down and saying, okay, good, this is how we do it. We're spending some time thinking about it and then trying it out. And the way we try it out, sometimes a little bit silly ways and sometimes a little bit of useful ways. It's all useful, but sometimes more sort of serious ways. Some silly thing we did a couple role playing and we just sort of like asked each other the questions to see how this felt. And we figured out some things. It felt sort of silly to ask some questions. It felt like, okay, this doesn't feel as scary or take as much time, always as we might have thought it did at the beginning. We also really think about, we've been spending time and reaching out to talk with folks about what the process is like and how they can make it better. So after they've gone through it, so we've talked to some of the staff who've done some of this work in First Connections and early intervention. And as we go forward, we're going to be constantly talking to staff and talking to families about the process for going through like our centralized intake mode, so that they can give us the feedback that will help us build a program that actually works. And a second challenge.
The second challenge is this seamless again through a different lens this time, and is this outcome driven? So we're looking at more of the upper rungs of our ladder here, connections between programs and connections between programs and the families directly. Looking at the guiding questions of how do we communicate internally to reduce staff workload while making it easier for families to navigate our agency? What do we need to know so that we can help families get connected to programs quickly and effectively? And how do we make sure that families are getting something each time that they interact with us?
And the human-centered design, the design principles here, we've just started this, we've done this with very few families, so we haven't had a chance to begin asking these questions yet. But really here, we're really thinking about how do we learn from families about what works for them in getting connected to the programs? And how do we learn from families about them feeling about making sure they get value out of each time they interact with us? So they're not just hanging up from the phone with like, well, somebody will call me again later, but hearing something that feels like they're going to be able to use it in the future or use it to support them already. And then internally, how are we making these connections between programs? So we have our centralized intake process that we think works, might change a little bit, but we think works. But how does that, like, how does the puzzle piece fit with each individual program? Because I suspect we think that the puzzle piece is going to be a little bit different with Nurse Charlie Partnership than it is with Head Start, than it is with Permanency. And that's important for us to really spend some time making sure those pieces fit together, and not that we just sort of drop centralized intake down on top of everybody and say, this is how it is, and you need to change everything to make it work for centralized intake. Because mostly programs are serving and supporting clients really well. So we need to build on that, not reshape it completely. So here's where we're going now.
So right now, as Josh sort of described a little bit earlier, we are running a pilot to work through some of these challenges, to figure out where other challenges might come up. And our current pilot, our current system is that we're working with early intervention, first connections, and early Head Start to start to think about these aspects of centralized intake. With our working theory, our rungs of our ladder here, we're thinking about how this could also be adapted throughout the agency, asking lots of questions of Justice Free Anne and Carmen so far to see how we can make this better and to make it more adaptable. We've tried out this process with one another, with our family members, things like that, but we've also talked with clients to try this process out to see how it works. We'll continue to start seeking feedback from both staff and from families. We've already sort of started this process, but we're definitely looking to ramp that up as well. Here, we'll continue to add programs throughout 2021 and 2022, very slowly, not necessarily all at once, because we want to be able to try out this process with each individual program and build upon, not reshape, as Josh sort of put it, by 2023.
And just to tie one more comment to innovation commentary, I think the idea of this is really that it's a process for working with each other to build this. And so this little circle is the process of building things. Programs and centralized intake will work together to take the centralized intake plan that we think works and mesh it together with what the program needs, make those puzzle pieces fit. Then we're going to try it out and we're going to make sure it fit. And maybe it didn't quite fit, so we need to make some changes so it does fit better. And then we're going to try again and see if that puzzle piece really does fit. And the goal, like we've said, is that this is a process of working together and learning from the positives and learning from the mistakes, so that we can build something that really meets the needs of our clients, really meets the needs of our staff, of us, and make sure that our programs are serving clients so we get the best outcomes we can. And we're really excited because we've actually been able to build this a little bit quicker than we expected, and we are looking for some help. We got a grant to support centralized intake, and we're excited to hire somebody to help really run this, to make it so we can really start to do centralized intake as a thing and not sort of talk about it and fill it in with folks' spare time like we've been doing so far. So we're hiring a bilingual centralized intake coordinator. One of the key aspects of this work is understanding some about Children's Friend and some about our programs. And so we would love to have somebody from Children's Friend who can really help to begin to bridge that gap and help us understand how we best support families and best connect them to all our various services. So if you're interested, please let us know. And you can let us know. This is our contact information. And we want to thank you guys so much for all of the time and your attention today.